Hi friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम एम्स भोपाल का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। Excerpt from the following, the defined form of CSSM is: A. Child security and safety measures. B. Child survival and sickness control measures. C. Child survival and safe motherhood. D. Child sanitation and safety measures. Correct answer, C. Child survival and safe motherhood. 62. Latent phase, alert line and action line are terms used in the context of: A. Biophysical profile. B. Partograph. C. Amniocentesis. D. Non-stress test. Correct answer, B. Partograph. 63. A mortality indicator among the following is: A. Incidence rate. B. Life expectancy at birth. C. Disability rate. D. Prevalence rate. Correct answer, B. Life expectancy at birth. 64. Which of the following organism jacks the cell wall? A. Actinomycetes. B. Staphylococci. C. Spirochetes. D. Mycoplasma. Correct answer, D. Mycoplasma. 65. The most common type of pelvis in females is: A. Gynecoid. B. Android. C. Platyploid. D. Anthropoid. Correct answer, A. Gynecoid. 66. The visual examination of the cervix and vagina by special instruments is called as: A. Hysteroscopy. B. Laparoscopy. C. Colposcopy. D. Salpingoscopy. Correct answer, C. Colposcopy. 67. Which of the following catheters is not used for total parenteral nutrition? A. Hickman. B. Swan-Ganz. C. Groshong. D. Broviac. Correct answer, B. Swan-Ganz. 68. Lethal effect of moist heat is due to: A. Toxic to mitochondria. B. Damage to DNA. C. Cutting off of nutrient supply. D. Denaturation of proteins. Correct answer, D. Denaturation of proteins. 69. Glenohumeral joint is also called: A. Hip joint. B. Elbow joint. C. Knee joint. D. Shoulder joint. Correct answer, D. Shoulder joint. 70. The cause for respiratory acidosis among the following is: A. Respiratory obstruction. B. Diabetic ketoacidosis. C. Excessive vomiting. D. Hyperventilation. Correct answer, A. Respiratory obstruction. 71. Slow infusion of isotonic fluid into subcutaneous tissue is called: A. Plasmapheresis. B. Dialysis. C. Hypodermoclysis. D. Enteroclysis. Correct answer C. Hypodermoclysis. 72. Complementary healthcare refers to A. Healthcare given free of cost. B. Healthcare delivered at home. C. Alternate systems of medicine. D. Doctor-patient relationship. Correct answer C. Alternate systems of medicine. 73. Is a protein involved in forming the cytoskeleton. A. Fibronectin. B. Albumin. C. Fibrin. D. Actin. Correct answer D. Actin. 74. The commission or omission of an act that a reasonably prudent person would have performed in a similar situation, thus causing harm to another person, is called A. Slander. B. Negligence. C. Assault. D. Libel. Correct answer B. Negligence. 75. Which of the following is not a role played by a nurse? A. Care provider. B. Diagnostician. C. Educator. D. Communicator. Correct answer B. Diagnostician. 76. In a patient receiving IV fluids, sluggish flow, redness and tenderness at the site of cannula indicates A. Venous spasm. B. Nerve damage. C. Thrombophlebitis. D. Infection. Correct answer C. Thrombophlebitis. 77. Carpopedal spasm indicates A. Hypocalcemia. B. Hyperkalemia. C. Hyponatremia. D. Hypomagnesemia. Correct answer A. Hypocalcemia. 78. The phenomenon at 8th week of gestation where pulsations are felt in the lateral fornices is called A. Chadwick sign. B. Osinder sign. C. Hager sign. D. Goodell sign. Correct answer B. Osinder sign. 79. The endotoxic activity of the gram-negative bacteria is due to A. Cell wall. B. glycolipids. C. lipopolysaccharides. D. aminoglycosides. Correct answer C. lipopolysaccharides. 80. Respite care refers to A. Rehabilitation. B. Part-time supervision of patients with chronic conditions. C. End-of-life care. D. Palliative care. Correct answer B. Part-time supervision of patients with chronic conditions. 81. Data that includes all the measurable and observable pieces of information is called as A. Objective data. B. Documented data. C. Hearsay data. D. Subjective data. Correct answer A. Objective data. 82. Uterus with depression at the fundus is called A. Arcuate uterus. B. Biconnuate. C. Septate uterus. D. Uterus didelphys. Correct answer A. Arcuate uterus. 83. Efficiency of dry heat is tested using A. Spores of mucar. B. Bordetella pertussis. C. Corynebacterium diphtheria. D. Clostridium tetani. Correct answer D. Clostridium tetani. 84. Monday fever is the other name for A. Anthracosis, B. Silicosis, C. Asbestosis, D. Bicinosis. Correct answer D. Bicinosis. 85. Elevated levels of antistreptolizio are seen in A. Cardiomyopathy, B. Ventricular septal defect, C. Rheumatic fever, D. Subacute endocarditis. Correct answer C. Rheumatic fever. 86. Diffusion through a cell membrane does not depend on A. Kinetic energy of the particle, B. Concentration gradient, C. Size of the particle, D. Charge of the particle. Correct answer A. Kinetic energy of the particle. 87. Skin turgor test is used to assess A. Consciousness, B. Level of pain, C. Hydration status, D. Infection. Correct answer C. Hydration status. 88. Which among the following is a criterion to classify a death as brain death? A. Hypothermia, B. Presence of EEG activity, C. Cessation of breathing, D. Responsive to deep pain. Correct answer C. Cessation of breathing. 89. Separation of a thought or memory from its associated feeling or emotion is known as A. Isolation, B. Projection, C. Idealization, D. Intellectualization. Correct answer A. Isolation. 90. The most common site of hospital-acquired infection is A. Respiratory tract, B. Surgical sites, C. Highs, D. Urinary tract. Correct answer D. Urinary tract. 91. Repetition of similar actions in similar circumstances is the definition of A. Emotion, B. Motivation, C. Attitude, D. Habit. Correct answer D. Habit. 92. The doctrine of informed consent deals with A. Patient confidentiality, B. Informing higher authorities about the patient's condition, C. Full disclosure of all relevant facts to the patient, D. Notification of disease. Correct answer C. Full disclosure of all relevant facts to the patient. 93. Nursing care that is based on identifying and meeting the needs of a patient is called A. Goal-oriented, B. Target realization, C. Prioritization, D. Client-oriented. करेक्ट आंसर डी क्लाइंट ओरिएंटेड। कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोस।